As Carter mentioned earlier, I think training is a place where if you're able to, uh, it's a good place for you to be able to learn workflows and not necessarily have to have detailed technical knowledge of a system. So I've seen that as a place where sometimes folks start out and then stay on with the customer and go on to get some of those certifications that are often necessary to get hired on in some of the roles. Other places where I've seen some people start out would be in project manager roles that are related to the EMR, but not necessarily directly implementing the EMR. So for example, I have a team member that is working on a SharePoint implementation and helping to bring together all the documentation, again, common themes, documentation around the project, education around the project. They get involved and are learning about a lot of what the project is about, but not necessarily having a certification. So those would be my pieces of advice.
Okay. Carter?
Yeah, I understand this is more of an informatics type crowd and maybe even clinically focused, but there's a whole segment of what we do, the technical segment. When you talk about engineers, you talk about architects, you talk about people that understand data, that crosses over from other industries into healthcare. And so if you've been working in financial institutions or manufacturing and you understand, just like a service-oriented architecture or integration and things like that, that crosses over a lot better than, a clinically related subject matter expert position or something like that.
Yeah, I'd build on that a little bit too. The first thing that came to mind to me was more of the technical and operations roles, but I don't think that's what attracts people to an informatics program, okay? But for any of you that do have that's very easily transferable. Another area that's been popular for years, and there is still a shortage of people, so a lot of people come in from other industry, is the information security area. And that's one that requires a very distinct set of knowledge and skills, and if you have that knowledge and skills, you can pick up enough healthcare to apply that. If you have them both already, you're in even better shape. I had another thought, but I lost it.
What do you think, Dave? What about sales and marketing? Nobody's mentioned those two areas, but what do you think about that?
It's just not an area our firm focuses in. I don't know if I would have good opinion on that.
But you've got a sales background, so do you think that coming from another industry, that a salesperson selling, say, EMR system to a hospital, that would be a good jump?
I just in general, I think it depends on the organization. Some are looking for content experts that will, with some light sales skill, and will provide the sales training. Many might consider somebody from outside of the industry who has a demonstrated track record in business development and provide the product knowledge. So it certainly could be one. I just don't have enough experience in that area. But from what I've seen, that's what I'd say in general.
I could comment on that one a little bit, because I work with a heck of a lot of vendors, and one of the hardest skills to find in any industry is good, strong selling skills. If you could make your numbers selling technology in a non-healthcare area and demonstrate, you're gonna be able to carry those numbers into healthcare. Probably once you learn about the hospitals, learn about the physician's office, pick up the right buzzwords. It'll take a little while to, but an employer would be willing to take a gamble on you. I see that often, especially if you're in a healthcare related area. Like a lot of the top salesmen selling the EHRs come over from the pharmaceutical side or the modality side of the industry, and do very well, or had been working in a networking environment or a phone company environment that also sold to hospitals and healthcare. So that I've been keeping my thinking for, I don't know what reasons, and I think the rest of the panel has too, is focused on jobs in the provider side, and in my case also in the hospital side. brought up an interesting way to expand that thinking.
Yeah, my comment on that, and I'm glad that you brought this up, Gwen. I had written this down as a talking point, but I feel very strongly about sales and marketing skill sets, and I think that everybody needs a little bit of that. Nobody wants to make cold calls, and we wouldn't ask our consultants to do that, but if you bring a little bit of that to the interviews and they feel like maybe this person could help in business development, you're going to get hired. And if you look around HIMSS, I'll bet there's more than 50% of the people here are salespeople. It's blue suits and dark ties. It's just, you can't get away from it. And that's just a life skill, really. I mean, it's not specific to this industry, but if you can market yourself or help another company market themselves, you are an asset to that organization.
And getting a job is all about sales. You're selling the most important product you'll ever be selling.
One angle related to that we haven't talked about is selling on the client side. So a lot of our customers are competing against like organizations in big cities. So in Chicago, there's any number of hospitals or doctors a patient could choose to see, and patient portals are where things are going. So I think there's a lot of work to be done in helping the patient understand where they fit in with initiatives that the hospital is rolling out, and that would be another great way to break in. That wouldn't require, it certainly requires knowledge of patient care and services that hospital provides, and many things you would learn, but not necessarily system. And I think it's a fascinating upcoming area.
Bonnie, I know you focus primarily on the C-level, so I'd love to know what your thoughts are on this.
Well, this is a great area to talk about because other industries are so much farther advanced in areas than healthcare. So if you look at other industries, there's going to, ERP, finance, HR, and those are still needed in hospitals to have experts who know those systems, and that's a good transition point. The technology areas, infrastructure, mobile tech, anything to do with the network, the data warehouse. Business intelligence right now is a very hot topic, and other industries are doing, better in that. Customer service, there's key health systems in this country looking for executives to be customer service type people. So that's hospitality, maybe even retail. So there's other industries that are doing things better than healthcare, and we need that influx. Security, I believe, was mentioned already. That's also, very, very important with the electronic medical record. So having a security professional with certification is common in other industries, and we look for that when we look for security people in healthcare. So that's another transition point. So there's telecommunications, there's different areas that people can transition in that other industries are doing much better than healthcare. We need those people.